Every day, patients from across BC receive specialized pediatric health care, but not all of them have to go to BC Children's Hospital.
Through Child Health BC, we're able to bring services closer to the child's home, and that way they can receive the very specialized services that the specialists at Children's Hospital can provide without having to travel.
Child Health BC is spreading across this huge province, providing better and more convenient care for families. For example, Nanaimo Regional General Hospital has its own Child Health BC clinic serving Vancouver Island families. This clinic had over 3,200 patient visits in 2011. One of those patients is Jonathan,
very healthy and happy and growing,
who was born with a disorder that affects his hearing, his vision, and major organs. Jonathan now gets most of his care in Nanaimo. Before, his mother would have had to drop everything to take him to Vancouver several times a year.
Where are you going? Taking time off work, making childcare arrangements for my other son, someone to watch the dogs, and getting nursing someone that would be able to travel with me. It relieves a lot of stress for me to be able to go 10 minutes down the road to the hospital instead of having to plan a major trip over to Vancouver. So being able to stay home and have consistency in his care and for his needs is huge.
Prince George is another place where children like Liam can get care closer to home.
Big hugs.
Liam has a respiratory disorder. On this day, he is at Children's Hospital. But thanks to Child Health BC, he gets much of his care from hospital specialists who make regular trips to Prince George.
We were able to utilize the services in Prince George approximately half a dozen times, and that definitely saved in cost of, flights and meals, even something so simple, and then of course any accommodations that would be necessary, so it saved us quite a lot.
There we go.
Child Health BC is helping caregivers across the province so that they can provide better care for kids in their communities.
Sometimes they need a standard of care, sometimes they need equipment, sometimes they need connections and mentoring from somebody at Children's Hospital.
The implementation of standards of care ensures that children receive the same great care no matter where they live.
These standards of care mean that a child with diabetes or cerebral palsy will receive exactly the same kind of care in Trail or Cranbrook as they would here in Vancouver.
What's this? Let's look at it.
For thousands of BC kids, Child Health BC means that Children's Hospital comes to them.
Because of Overweighty Food Group and our other donors, we've been able to move services forward in this province for children in a way that's simply not possible in other provinces, and we're really grateful that we've had that opportunity for the children of British Columbia.